Dr. Shireen Kassam, thank you for welcoming us from your location, I believe, in the United Kingdom. Could you kindly introduce yourself for the audience, please?
Yes, thank you, Florence, and thank you for the invitation. So my name is Shireen Kassam. As you say, I'm based in the UK, and I'm a consultant haematologist working at King's College Hospital in London. So I treat people mainly with lymphoma, and I also involved in laboratory diagnostics, so diagnosing the condition, performing genomic testing, that sort of thing in people with lymphoma and other haematological cancers. And I also work at Winchester University here in Hampshire in the UK, where I have developed and facilitate the UK's first course on plant-based nutrition, and that's aimed at healthcare professionals here in the UK, adding to their toolkit, hopefully, of things that they can use within their clinical practice. And then outside of my sort of professional and paid work, I'm founder of two community interest companies. So that's sort of non-profit companies here in the UK. So firstly, back in 2018, I founded Plant-Based Health Professionals UK, which is a membership organisation that's dedicated to providing evidence-based education and advocacy on the role of healthy plant-based diets for prevention and treatment of chronic illness. And then bringing that more into the public-facing, patient-facing arena. Just this year, I launched with my co-founder, Dr. Laura Freeman, who's a GP and lifestyle medicine physician, an actual healthcare service called Plant-Based Health Online, which really brings together the aspects of lifestyle medicine that I'm sure we'll be discussing alongside plant-based nutrition in order to use that with patients and clients who are looking to optimize their health, improve their underlying health conditions, and hopefully try and treat chronic common conditions such as high blood pressure, high cholesterol, GI issues, that sort of thing. So it's the first lifestyle medicine healthcare service in the UK that's regulated by our Care Quality Commission, and we use plant-based nutrition as first and foremost as a way of improving our patients' health.
That sounds like a very busy schedule. So to unpack this a little bit, let's go back to two critical notion, which I think you've mentioned in your presentation. Number one, lifestyle medicine. Number two, plant-based diet. So in the interest of debunking all the stuff that's out there, both online and diet books and all the stuff that we hear on the media, social media, etc., help us understand what are these two constructs, this concept of lifestyle medicine, number one, and two, a plant-based diet, and what it's not to be confused with.
Indeed. I might start with plant-based diets, if that's okay, because that's kind of how I came to this back in 2013. So I decided to adopt a plant-based diet or a vegan diet, mainly for ethical reasons. I no longer wanted to be part of the use of animals as food, and that includes eggs and dairy. And so I started looking into the science behind plant-based diets. How was I going to live healthily on a 100% plant-based diet? And this was 13 years into my career as a qualified doctor. And I came across a wealth of information that demonstrated quite clearly in the scientific literature that the more your diet is centered around whole plant foods, so that's fruits, vegetables, whole grains, beans, nuts and seeds, the better the health. And that can be a spectrum from, diet patterns like the Mediterranean diet, for example, or, traditional Japanese diet, or, as my choice was, 100%, which is a vegan diet. And, as soon as you're getting to sort of 85 or 90% centering your diet around whole plant foods, then you're getting those benefits. And it's also perfectly acceptable and desirable to follow a 100% plant-based diet, not only for health reasons, but obviously, as I've said, for the animal justice reasons. And now more and more, we're recognizing it is one of the key solutions to combating the climate and ecological crisis. So that's kind of how I came to it. And once I realized that, using a plant-based diet, whether it be virtually plant-based or 100% plant-based within the clinical practice, could really provide people, patients, clients with astounding sort of health benefits. I sort of wanted to start talking about it and providing education about it as something that wasn't really present in the UK at the time. So it took me a good 3-4 years to really educate myself, because it was sort of new to me and I wasn't practicing in that field. And then that was kind of how I got going with the education side of my non-profit work. And as you say, the science is overwhelming. As long as you're having a healthy whole food diet, avoiding as much as you can the processed foods, and in the same way that any diet pattern should, then 100% plant-based or vegan diet is really achievable, affordable, and desirable for all the reasons I've mentioned. But that then sort of opened up this bigger picture of lifestyle medicine, because I realized there was a growing movement globally, mainly coming out of the US, but having, crossed borders and, country boundaries, and really having infiltrated the rest of the world of lifestyle medicine. And I mean, it started back in 2004 with the founding of the American College of Lifestyle Medicine. And then something happened back in around 2014, 2015, which made it a global movement. And we now have the British Society of Lifestyle Medicine here in the UK. And at the core of that is really going back to the root cause of our chronic illness. So globally, the vast majority of illnesses, disability, deaths are caused by non-communicable diseases. So cardiovascular disease, predominantly heart disease, but also stroke, high blood pressure, high cholesterol, cancer, type 2 diabetes, and more so cognitive decline with dementia. And all of these illnesses share some common factors. The main risk factor now for all of these illnesses is an unhealthy diet. So we learned back in 2019 that the single most important leading risk factor for chronic illness and death was an unhealthy diet, leading to 20% of deaths globally. And then alongside its other sort of unhealthy lifestyle behaviors, such as tobacco smoking and excessive alcohol, inadequate sleep, stressful life, inadequate physical activity, and not maintaining our healthy relationships. And if we bring together those 6 key pillars, which are termed lifestyle medicine, we have the potential to really impact the health of ourselves and populations and our patients in general. And that's what lifestyle medicine is about. It's about bringing together those 6 key pillars of lifestyle medicine in order to enhance what we can do for the health of our patients. So it's alongside what I would sort of term more conventional westernized medicine that I learned at medical school, bringing together these key lifestyle factors. And it seems all such common sense, doesn't it? But we've moved away from that in conventional sort of Western medicine, where we're very much taught to use medications and procedures and surgeries to help our patients. And then bringing it back to the plant-based nutrition, the American College of Lifestyle Medicine have a position statement on the diet pattern that is associated with the lowest incidence of chronic disease and can be used in clinical practice to reverse chronic disease. And it's what I describe. It's a predominantly whole food, plant-based diet centered around fruits, vegetables, whole grains, beans, nuts, and seeds. What you do around the edges is kind of your choice, but it should be minimized as much as possible. So now we're in a position where, lifestyle medicine, plant-based nutrition comes together to really help our patients achieve their best health.
And what would you say, certainly before 2020, because then we'll talk about how the impact of the pandemic and metabolic health of the populations in our country had an impact. But let's go back to before that. Up to 2019, how much would you say would be the percentage of healthcare in the UK of practitioners that have either this background or that actually agree with it or tolerate it within their practice? So there's 3 degrees there of practice and integration. How much is this? Because in our sense here from Singapore, from Asia, from the US, from Europe, you can see that certain movements have disproportionate strength in different countries for political reasons, for healthcare reasons. So I'm very curious to see, what do you think before 2020 was the state of the healthcare system in the UK?
Yeah, no, that's an interesting and very relevant question. Well, on a government and policy level, when it comes to the money spent on public health and preventative care, we know it's only 5% of the billions that are spent on our healthcare overall. So 5% of money is dedicated to that. And that hasn't really changed much in years, despite the sort of narrative coming from government that they want to have, improved public health and healthy diets. It's the rhetoric rather than putting it into practice. On a sort of professional level, I think awareness has grown. I think nobody will disagree that lifestyle factors have an enormous part to play. We mustn't forget that amongst lifestyle factors that I've mentioned, we also need to include social determinants of health, so social and economic determinants of health. And I think there's increasing understanding that that divide between those that have and those that have not really impact health. We know that that is actually getting worse, despite us understanding that, educational attainment, income, housing, all those sort of things are important in determining our, long-term health. That has worsened, very much it's pointed towards, the austerity sort of policies that the Conservative government brought in, such that, those from wealthier postcodes in the UK compared to those more deprived postcodes are living 10 to 12 years longer and better health than those who have less. So, although we acknowledge it, we haven't done anything about those structural aspects of our health and well-being. I think as physicians, we truly understand that lifestyle and socioeconomic factors impact our patients' health, but we still face, real barriers of how to incorporate that into our clinical practice. If only 5% of the budget is being used for that, it means that the rest is used for firefighting. And so both in primary and secondary care, we're seeing the end stage of all these factors coming together where it's very difficult to, in a short period of time, make an impact, and you have to use those sort of tools like medications and surgeries and procedures because your patients are so unwell. And so although we recognise it, I think we find it difficult to put it into our clinical practice. Having said that, as you probably know, there's a global certification and diploma in lifestyle medicine. I think the first year it was held in the UK was 2018, where 40 doctors took it. The following year, 100 doctors. And since then, we're nearing probably 1,000 doctors that have got a qualification. But that doesn't mean that other people aren't using it in their own way. But we have got this issue of combining what we know to be correct and the correct way of practicing to kind of how we're incentivized in the NHS to practice medicine, and that's not necessarily by using lifestyle measures. And it also raises the issue of, if you want to implement sustainable lifestyle changes for your patients, you have to address key root causes of behaviour and what drives that behaviour. And that takes time. It takes a lot of time and effort to understand your patients and be able to help them in a way that's unique for them. And we just don't have that embedded in our clinical practice yet.
And in terms of social determinant of health, so in the UK, I've worked a little bit in Scotland within the NHS, and we were working with a hospital in Glasgow, the largest hospital there, talking about cardiovascular diseases, and especially associated with certain socioeconomic barrier. And something really struck me at the time was walking through streets, not just in Scotland, but in London as well, and realizing the density of fast food and food, junk food availability. And by junk food, I'm very, very broad. I'm not just saying what you can find 7-Eleven, but something that looks like a restaurant, but actually it amounts to whatever they sell in there amounts to junk food. And effectively, that the exposure amounted to a risk factor because you weren't exposed to a market, or you weren't exposed to a single piece of fruit that you could rely on. So that's 2019, before we hit this pandemic, where some of the risk factor actually brought in metabolic health component to it. So how would you say the general metabolic health of the UK has been evolving according to your own expertise as a physician, having been around in your profession for more than a decade. So you'll be able to have a good handle of this evolution.
Yeah, I mean, so just in my practice, which is now, I'm in my 21st year of being a doctor here in the UK. Yeah, I mean, sadly, I think the health of the nation continues to deteriorate. That was shown clearly in a global study that was published in The Lancet just last year, at the end of the last year. As I say, the gap is widening between, socioeconomic determinants of lifestyle factors and then the knock-on effect with health. And we are living longer in ill health. So on average, in the UK, we spend an average of 12 years at the end of our life in ill health. That has got worse in this last decade for sure. And, we're starting to see plateaus in life expectancy. We're not seeing those year-on-year gains, and, the predictions are that they will start to decline, and we're not getting those same gains in improvement in cardiovascular disease. And in the front end, we're seeing more chronic illness in our children. Overweight and obesity rates are rising. It's not unusual to diagnose type 2 diabetes before adulthood. People are getting younger and younger at the age at which chronic illness is being diagnosed. 1 in 4 adults is living with a chronic underlying health condition, essentially. And I think diet quality has paralleled that, along with other factors like, physical inactivity, stress levels. Of course, in the last 18 months, that's been even worse for many people. Our sort of social interactions and things, we don't necessarily give ourselves time to just be and enjoy company, go out in nature, those sort of things. So and I think the cities are worse, somewhere like Glasgow and London. The availability of these unhealthy foods and the way they are presented, we know calorie for calorie, they are cheaper than buying your calories from broccoli and apples. They're convenient, people don't have time to cook. They're marketed in such a way that they make it desirable for us to just reach for. And, we know that they're engineered to almost be addictive, that we want to go back for more. We think we want those flavors, and it sort of numbs our taste buds to the foods that we really should be eating.
So in your opinion as well, what is creating this huge force that seems to be preventing common sense about how we live to be adopted as the main policy? What is creating the fact that we seem to have enough science, enough data, we seem to have some people that are willing to practice it, and yet we're still in the mode that you describe as firefighting mode, which is that either we point to people, they're unfailing, you're fat because you're lazy and you're incapable of sticking to a diet, or let's wait until there is a problem and the problem is so big, and that's for the doctor then to sort it out with the patient. What do you think is creating all these blockage, and also who's turning diet into a religion, such that plant-based people or vegan people or keto people or fat-free or low-fat, or why have we created, or who has created this? And if so, how can we beat them?
Gosh, Florence, that really is a complex question. And I guess if we all knew the answer to that, we'd be able to unpick it.
That's your Nobel Prize right there, waiting to be received.
Yes. I think it's on so many levels. There's so many factors to unpick there. I mean, just on a sort of system and structural level, our food system has been taken over by the corporate sector. It's some ridiculous stat, like 10 main corporations control the food system globally. So we're not in control, even on a country level, of like who is producing our food. The corporate industrial food complex is really powerful. There's big corporations making food that if they want it to be shelf stable and desirable and tasty and reach the supermarket, it needs to be sort of industrially engineered to meet those requirements, and then by definition it's less healthy, and they have a lot of money to get themselves positioned in the marketplace, and they're in cahoots with the government. The governments are beholden to them in a way. They're so powerful that policy change is virtually impossible or takes decades. Just taxing high sugar, fat, salt foods is just impossible. And we're in a situation where, a lot of the policies are put forward to the industry as voluntary. You should reduce your salt content, you should do this. Well, what's the incentive? So I think that's one really big factor there. I think in the UK, for sure, the farming policy and the food production policy has never really been linked up, even just in government departments, with the health policy. Farming sits separately from health, which is ridiculous. And we're in a situation where 70% of our farmland is dedicated to producing food from animals, so whether it be grazing or growing crop. So 70% of what we produce is animal-based foods, and we're exporting some of our meat to other countries. There might be a bit of an excess, yet the foods that we actually need to eat for our good health, the fruits and vegetables, we're producing less than 50% of what we need, and we're having to import those and then having issues about the supply chain and what have you. When we have loads of land that could be dedicated to producing fruits and vegetables and whole grains and beans. We don't need to be dedicating all that land to meat and dairy. But again, the meat and dairy industry have become so powerful now, and also they are subsidized by the government to keep producing that food, when actually, when you do the sums, they're not economically viable. And if you took on the environmental damage that these foods are doing and costed that out, you're running negative on the investment that you're making on that. It's damaging health and the environment. So that's all upside down. And we have had a national food strategy review recently, which has pointed out that fact, but then sort of slightly watered down the recommendations. It's recommended we reduce meat consumption by 30%, and we increase fruits and vegetable consumption by 30%, and fibre consumption by 50%. But to do that, we have to produce the food that we need to eat. So we have to turn the farming system on its head, and that's going to take time and the right incentives. So that's just two of the kind of systemic and structural issues. And then the other end is what we've talked about. I think people have got poorer. They don't have the time. They need two jobs. They may be food insecure. The poorest 10% have to spend about 70 or 80% of their salary if they wanted to eat a healthy diet, whereas the wealthiest 10% spend less than 10%. So, there is that divide, and that sort of exacerbates those factors. And then, just in terms of my own education, it hasn't caught up yet, has it? The curricula for nursing and medical school and what have you has not really caught up. And it is, and we're managing to sort of, get on board with medical schools through the work that I'm doing with plant-based health professionals, but it's one school at a time. There's it's just not going to be fast enough to impact our patient care. And if you think somebody like me's taken best part of 10, 15 years to get to my senior position, it's going to take a long lag phase to get there. And then just coming back to the diet wars, it's ridiculous. It really is ridiculous. I think we all agree. We can't disagree on the fact that fruits and vegetables, whole grains, beans, nuts and seeds are at the centre of every diet, every healthy diet pattern. We've known that for decades. Every country-based dietary guideline says the same. Even those that have been updated recently, like Canada, for example, they've got a very progressive, predominantly plant-based dietary guideline where they've stuck to the science. 3/4 of the plate is made up of healthy plant foods, and then they have a quarter section for protein, and it says get your protein from plant-based foods, and it's removed dairy as a food group. But the population aren't sticking to the guidelines, and if we did, we would be in a much better place. And partly the reason we're not is because there's all this disagreement in kind of mainstream media about what we should be eating. And of course, media thrive on that. So does industry, because they can carry on selling certain groups of people certain types of foods. So it's enormous. It's enormous. But I think from my point of view as a healthcare professional, I have a duty to educate myself. I have a duty to prescribe lifestyle and diets that are not only sustainable for the patient, but for the planet in general, because we're at a crisis point. And I have the duty to offer all these options to my patients, and then patients will decide what they want to do. But unless you offer it to them, you just don't know how. It's not, you can't withhold this information. You have to offer it in a way that the patients can make a healthy decision for themselves.
So my next question was going to be precisely that. Do you get a lot of pushback from your patient, especially from those who may come from a totally different angle? Let's say they get diagnosed with a blood cancer or blood condition, and their assumption was that this is purely a quote unquote mechanical illness. And then this physician is coming at me with the sense that I need to change everything about myself, how I eat, what I eat, etc. So what is the response of your patient? Is it confusion? Is it pushback? Is it, oh yes, I'll do whatever to survive? What kind of response do you get from patients?
Yeah. Well, I have a sort of unique clinical practice. I am seeing people at the time they're diagnosed with a cancer, lymphoma, and that's not necessarily related to diet and lifestyle at all. I mean, it's a combination of factors. And so, it's not directly impacting the care there and then. However, my patients, like all the other people, citizens in our population, also have other chronic illnesses like hypertension, high cholesterol, diabetes, cardiovascular disease. So that's kind of where some of my conversation is directed at, because those underlying conditions really do hamper the treatments that I can give, and it also impacts their long-term outcomes and the sort of side effects of treatment and how they tolerate treatment. So there's that piece of it. If people came to me without any of these common lifestyle related diseases, my job and their job would be so much easier getting through cancer treatment. And then my patients they all ask, what can I do, doctor? They're at that point and you've given them a life-changing, life-altering diagnosis. That's kind of a real teachable moment. Obviously you want to be getting people beforehand, but in that one moment in that clinic room, they are motivated to take on that information. And no, nobody is surprised or gives me pushback when I tell them that the healthiest diet for cancer is one that's centered around whole plant foods. And the thing is, I'm in a really lucky position, because you look at the World Cancer Research Fund guidelines on cancer prevention and survival, 2018, it says eat a diet rich in fruits, vegetables, whole grains, beans. I mean, that's the kind of diet I'm talking to them about. So I have no problem about that. But then the challenge arises about how you implement it, how patients adopt it for themselves, their social support, their financial ability, most people are more worried at that one moment in time. Oh my gosh, I'm going to lose my job. How am I going to afford my mortgage? Those sort of things. So it's very person dependent, and you have to go with an approach that's appropriate for that individual and help them make whatever change is in their capability at that moment. And then slowly over time, as you meet them more, as they finish treatment, then you can reinforce that information. But no, I don't get pushback. I think nobody is going to disagree when their doctor is telling them that healthy plant foods need to be center of their diet.
It's probably a function of the type of illnesses that they're facing, because I remember clearly talking to many doctors who were much more maybe cardiologists or people who are in GP, internal medicine, and they do get a lot of pushback from patient when they say, oh, you need to start looking into your diet. And then the war comes out, which is what diet, which box am I in? And I think that part of maybe if it's not engineered, part of the problem is that this dissension that we have of pointing out people, oh, here comes a vegan, or here comes a keto guy, or here comes whatever, is also part of what's making the whole thing perpetuated over time, rather than saying, how can we make everybody feel better live longer, and don't put a tag on it. We don't need to call it a certain type of diet. We need to follow base common sense and applicability for this patient. So, but it seems to be at the apex of problematic for people who deal with metabolic condition and chronic condition. So it is interesting to hear from an oncologist like yourself. I have other oncologist colleagues who have confirmed that as well, that people once in that unfortunate, very serious illness prospect, they sort of flip, and then now I need to do whatever I need to do, and if I can afford it. That's a big caveat, if I can afford it. So if I can then take us all to 2020. So 2020 comes along, and here comes a pandemic, which now we have to deal with. And each country actually dealt with it somewhat differently. But what we couldn't differentiate was the factors, the risk factors. And it seems that if we leave age for now, because there's not much we can do about age, it seems to be very coherent. And in every country, metabolic health was a major component of responding very poorly to SARS-CoV-2. So what was your experience as a physician? And when did you, if you did connect the two, what happened then in terms of metabolic health in this disease?
Yeah, no, I think it's been a really important 18 months for us to really truly understand that our underlying chronic conditions, cardiometabolic situations are so key to how we deal with these infectious threats that on an individual level are not in our control. So it taught us that very early. I mean, the UK had really picked that up very early on. So we had I think it came out in preprint maybe June, July of last year, where 17 million primary care records were analysed, and what they were able to show was that those people who died of COVID-19, more than 90% of people had one underlying health condition, be it hypertension, other cardiovascular disease, cancer, immune deficiency disorders, type 2 diabetes, and of course, being overweight or obese was a key risk factor as well. And when you think that 2/3 of the UK public are overweight or obese, that's a terrible metabolic situation to be in. Excuse me. So, that was made clear early on, and the government jumped on this sort of information and started putting out, information about how to keep healthy and exercise during the lockdowns. And they created this healthier app for people to change their diets. It was a 12-week program, but really, I'm quite short-sighted to think that people would be able to revolutionize their life by looking at an app for 12 weeks. It doesn't really work like that. If it was that simple, we would have all done it before. And then as time has gone on, that information has just been confirmed, as you say. I remember reading at the beginning of this year a large study of 1 million admissions to hospital in the US. And they were all admitted with SARS-CoV-2 infection. And it found that 60% of these admissions could have been avoided if people did not have overweight or obesity, high blood pressure, heart failure, or type 2 diabetes. 60% could have been wiped out if we didn't have those conditions in society. And so it's huge. I guess in my clinical practice, it was, it's sad to see, obviously, our patients with cancer have suffered, and that's not in their control. We can't say that you could have prevented the lymphoma I deal with, or every single cancer. And so it has been a really difficult time. I mean, as a professional, I've carried on in cancer care rather than having to shift to the front line, because of course cancer care has had to carry on. You can't stop, treating our patients with cancer. But yeah, it's hit them hard, especially the hematological cancers, which fundamentally affect your immune system. But that's not to say that's in anyone's control at all. That's just an unfortunate situation. And then on a wider level, Well, I mean, again, the other thing that it's highlighted in the UK is that those from lower socioeconomic backgrounds and also ethnic minorities have suffered the greatest. And the link with the ethnic minorities, like myself, the South Asians, it's also a combination that we're overrepresented in lower socioeconomic groups in the UK, but also that we seem to be ultra sensitive to these lifestyle factors and cardiometabolic illnesses. So in South Asians, we know we have 2 times the risk of cardiovascular disease than our white counterparts. Same with type 2 diabetes, and it seems to happen a decade earlier than my white peer group. So, and it's not dissimilar in the Afro-Caribbean population as well. So for those combinations of reasons, South Asians and African and Caribbean people have suffered badly during the pandemic as well. So that's been highlighted. So I mean, I think, and I think the wider context of how pandemic viruses are generated, we can't ignore, can we? I mean, I know there's debate about where SARS-CoV-2 came from, but ultimately it's from our interaction with animals, their habitats, either use in experimentation or their use as food. That's how it happens. We've encroached on their habitat and we've made these viruses come into contact with us in a way that don't really happen in nature if we were looking after our planet and our fellow species. And I think we can't ignore that fact. And even, just this week, there's new reports of influenza type viruses, in pigs, in birds, that are going to jump and cause infections. So that bigger piece, I really hope we learn our lesson, because otherwise, the next one is just around the corner.
And in your practice during this pandemic, so I don't know, I'm less familiar with how much lockdown you had in the UK, but we had some lockdown here, although not as strenuous as other countries. So did you actually find that your patients were scared to go into hospital and to get to their normal treatment? And if so, how did you organize the care around that?
Yeah, no, as I say, it was a really difficult time. And yes, we were all scared, even as physicians, we were scared, but patients particularly, of course. People wanted to avoid hospital as much as possible, limit the time they were spending there and not coming up for unnecessary appointments. And yeah, we had to adapt. So if and when we can, we still do telephone or video consultations. There was a lot more community help with doing, routine blood tests or blood checks in between chemotherapy appointments. Certain chemotherapy medications where there was an option, there was pilots of delivering those at home, which hopefully will continue as well. I think those were the main things that we could do, and obviously sending prescriptions home so people didn't have to come up to the hospital to collect their prescriptions, and similarly with their sort of chemotherapy tablet medications. But a lot of the treatments we do give are specialist and need to be delivered at the hospital, but certainly the sort of in between appointments we were trying to make less. And then obviously the pathways, we learnt a lot during the first wave of what we needed to do to prevent infection when people came to hospital. And so our pathways were put in place to make it as safe as possible. Doctors get regular testing in oncology for PCR testing for SARS-CoV-2. We've been doing that for over a year now, and also the patients get regularly tested as well and so that's part of our procedure now.
And in your experience talking with patients and looking around also when you were yourself probably immobilized, did you find that reverting to really bad food was a response to the stress of the pandemic, or rather that people actually decided this is the time where I'm fixing myself and I'm actually spending a lot more time cooking the right food? What was the response there, at least anecdotally, around you?
Yeah, I think well, both anecdotally and what's been written about in the medical journals as well, when groups of people have been surveyed, I think it's been a really mixed response, hasn't it? You know, some people have reached for sort of comfort food and become more sedentary, and others have really been motivated to improve their health and buying more fresh fruits and vegetables, cooking more from scratch. Obviously, we've all eaten out less as well, and you know, making that effort to go on the daily walk or exercise a dose that we were allowed to get during the lockdown. So I think it's been mixed from my own experience and what's been written about, but it does appear that in the medical literature that certainly in America there's been 2 papers showing that adults and children have actually gained, so adults have gained about £1.50 a month. I mean, that's quite a lot for 18 months, and yeah, so I think overall I suspect the general trend is that our body weight at least has gone up a little bit on average, but as I say, it's been a mixed response with you know, from my personal experience, you know, my husband, for example, really was overweight before the pandemic, and this was the kick he needed to get healthy, and he's lost 2 stone in weight and in a, you know, much better shape. So I think it's really been individualized, but I fear that on a population level we might have deteriorated actually.
And I think stress probably didn't help much about that, with the amount of time that people spent on screens and being fear shaken by different numbers of coming at them 24/7, really. And I think in Singapore, being such a small city state, for example, I was stunned by the amount of delivering motorcycles and delivering system, because people, instead of going out, which is a big thing that we do in Asia, or at least in Singapore, people decided, right, okay, so we can't go out because outside is the risk. So now we sit here and we get the food coming to us. But the food was not the greatest food. It wasn't broccoli on wheel. It was really fast food, junk food, comfort food, whatever you want to call it. And that's very worrisome. And then similarly, I don't know if you had this phenomenon happen, but here a lot of the shops that actually went under during the pandemic were perhaps non-food shop. And because the economy is quite tight right now, a lot of these shops were transformed into other things like takeaway food or food, beverages, facilities, because that's the thing that you can kind of turn over quickly. And I was thinking about exposure things. If you increase the density of such F&B, and yet this is the same population, even because now we don't have tourists and we don't have travelers. We only have one stomach, and there's only so many times a day that one person can eat. So isn't that just preparing the next public health tragedy? And that will haunt us for decades to come. Just with this one blip into longitudinal data, you could literally point out 2020 and 2021, perhaps less 2021. What are your views on this in terms of what happens next in the next 5 years for public health?
Yeah, well, I mean, I think we really do need to take stock, right, and put our money and mouth where the science is taking us. I mean, we really, really, really need an overhaul of what we consider our healthcare system, you know, because as other people will have said to you, it's a sick care system, and that doesn't work. It just keeps us in ill health for longer, and you know, impairs our quality of life and reduces our productivity and all those things that are important for society as a whole. So we need a radical overhaul. We really do. And it's going to take, you know, a lot of, you know, well, it's going to take a lot of strength if governments want to change their policies to reflect the science, because actually what we haven't mentioned, and one of the lessons that we are starting to learn from this pandemic, is that we've now got 2 studies that have shown that a healthy plant predominant diet actually reduces your risk of severe COVID-19. I mean, that's phenomenal, isn't it? That an actual diet can reduce your risk of the severity of an illness. And that's independent of your underlying health conditions. So, if we don't learn now, I don't know when we will. And I hope that healthcare professionals also take that on board with their patients when they're treating them.
So if you were Xara for a day, if you're prime minister of a country, we won't name the country, you can choose it, big or small, and you had all the tools in your pocket with all the knowledge you have, what are the things that you would put in place to help towards better health?
Yeah, I think it needs a systemic and structural change in our food system, everything that makes that up. As I say, it has to start with what you produce. If you're not producing the right food, how can you even expect citizens to make the right choice and and choose the right food? So we just need to, as much as possible, get rid of animal agriculture. Factory farming needs to just be outlawed, and we need to start growing fruits, vegetables, whole grains, beans, and from that will populate the supermarkets and the restaurants and everything. And we need to use that money to make it affordable for the farmers and for the people purchasing it in the same way that we currently do for meat and dairy. So we just need that money to go to food production. And, that obviously has the knock-on benefits for climate and ecological crisis, because our diet choice is the low-hanging fruit when it comes to this climate crisis. It's something that we can all do right now. Most of us can do right now, but it does need to be facilitated by government policy that makes that food available, accessible, affordable to all. Adopting a plant-based diet is the single most important, impactful thing you can do as an individual to combat climate change, and it will improve your health. So I think revolutionising the food system and food production here in the UK would be what I would do here in the UK.
So to conclude this conversation, which is really enlightening, I really enjoyed speaking with someone that's both passionate and scientifically educated enough that it informs us all. So around your own experience, both as a physician and somebody that's involved in entrepreneurship as well as trying to change your environment around, what has brought you to be who you are and to still remain optimistic and to still, in front of this huge challenges that we've talked about, to be able to say every morning when you wake up, I think I can make a difference. I think it will work out. I'm optimistic. What's making you deal with these challenges in an optimistic manner, if you are? And I'm sure as a physician you have to still be around, and you've been a smiling face all through this interview, so I know you're not burnt out. So what's that context and environment that makes you the special person that can do that?
Well, thank you for asking. I don't feel like I'm any extra special compared to anyone else. I have just found a passion that makes sense to me. There is a solution that's so easy, and the thing that motivates me sort of day to day is our members. So, as I said, we have a membership organisation, Plant-Based Health Professionals, and virtually on a daily basis, I hear from people, even if they're not members, just people that connect with me and our organisation via email or social media, just saying how powerful a plant-based diet has been to their health journey. What an amazing improvement they've had in their health outcomes, that they've reversed their diabetes, they've come off their high blood pressure medications, their high cholesterol. And, listening to Dr. Laura Freeman, who's the medical director of Plant-Based Health Online, which, we can see people online appointments, and hearing just how in a few weeks her patients are coming back to her and saying how amazing they feel. So we have this tool at our fingertips that we could put into action if only all the pieces were in place. And then, at the core of it is living more compassionately on this planet. We can live a kinder, more compassionate life. And, I've got to do my bit to get us to that better place. So that's what keeps me motivated.
So, Dr. Shireen Kassam, share with us then what's your weird sauce for life?
That's such a funny question, and I'm not quite sure how to answer it. But I guess for me in recent years, it's really understanding, as you've highlighted, what motivates me. Like, you have to sort of understand the why. I think before I sort of came to this via the vegan route, I think I was probably just getting up to work for the sake of it, for going in, earning my money. But I think more recently, I found a purpose, and that is one of the keys to, the lifestyle medicine, is knowing your purpose and knowing your place in kind of the wider society. And even though it's just a small thing, it feels like I've found my sort of important contribution to make, certainly within the UK space of healthcare and plant-based nutrition and potentially veganism. So I think that's kind of what I've learnt, keeps me going, and maybe qualifies your answer as being weird sauce.
It certainly does. Dr. Shireen Kassam, thank you so much for having this conversation with us and taking time to answer such important questions. And we wish you all success in keeping that motivation up and changing people's life for the better, with both knowledge, science, medicine, and compassion, empathy, and time, which is very, very important in this day. Thank you very much, and we wish you all the best for the coming 2021.
Thank you, Florence, and thanks very much for having me on your show.
If this conversation stopped you in your track, share it with your network. You never know whose life you might change for the better. Thank you for listening. Stay curious about our next guest, and stay curious about life.